Sure. Good morning, everyone. Good morning and welcome to Columbus Public Health. I am your Health Commissioner, Dr. Mashika Roberts, and thank you so much for joining us today. It is my pleasure to welcome you all here to talk about a subject that's very near and dear to my heart, as well as very important to public health and all of us. New violence prevention initiatives that will help us make our neighborhoods and our city healthier and safer for all residents. Gun violence is a public health issue, and it needs to be addressed in the same way we address other public health issues and other public health challenges. Today, you'll learn more about the new and innovative ways we will all work together to decrease violence, in addition to the things we are already doing. Columbus Public Health is committed to this effort. I am honored to serve as the lead for the Violent Crime Review Group under Mayor Ginther's comprehensive neighborhood safety strategy. I share the mayor as well as City Council's commitment to addressing violence in our community through innovative efforts that you will hear more about in a few minutes. Please join me in welcoming Council President Shannon Hardin, who is here to tell us more. Council President Hardin.
Well, thank you, Commissioner, and thank you all for joining us here at Columbus Public Health. We truly have the best health commissioner in the country, and I am very appreciative of her work and her team's work and commitment to seeing violence really as a public health issue. The entire health department has really stepped up in ways that we are very appreciative of to continue to make our city safe. You know, we all know that last year, and first I want to say thank you to all of my colleagues for being here. This is a collaborative effort. We have all worked extremely hard to make sure that Columbus is safe. So thank you to all of my colleagues. Thank you to Councilmember Liz Brown, to Councilmember Tyson, to Councilmember Mitch Brown, to Councilmember Jaiza Page, and I see President Pro Tem Cinziano here as well. So we all know that last year, 2017, was an abnormally high rate in homicides in our city. We have joined together with the community to hope and to pray that was just an anomaly. But we're not just hoping and praying, we're going to work together to make sure that is the case. Late last year, Mayor Ginther and I announced, and Council announced the Community Safety Strategy. This wide-ranging plan includes expanding Safe Streets initiatives and creation of the Interdepartmental Violent Crime Review Group. As a part of this strategy, Mayor Ginther and I came together to announce that we would be adding 100 new recruits to the Columbus Police Department. As partners in this work, Council and Mayor Ginther collectively funded these new officers. But as we said then, Columbus cannot solely police our way to a safer community. That's why Council committed $500,000 towards community-based safety strategies. These strategies are aimed to prevent violent crime without use of handcuffs and truly to build on what works in our community already. The strategies and principles outlined today are designed to catch violent crime upstream, to prevent dangerous situations from ever arising. At this point, I'd like to invite up Councilmember Elizabeth Brown, who has been critically engaged in this conversation, to outline the principles behind our work. Councilmember, and our newest Councilmember family, Mr. Russell.
Thank you, President Hardin. I'm still technically on maternity leave, which is why I have my child strapped to me. He's sleeping, so I hope he won't chime in. Thank you so much, President Hardin. In February of 2018, as President Hardin said, Council and the Mayor committed not just to additional safety forces to combat our safety concerns in our neighborhoods, but crucially a matching amount to community-based interventions. And we believe those community-based interventions are the long-term strategy to safe, thriving, equitable neighborhoods. So today we're announcing that Council has assembled a framework of 4 focus areas for this funding for 2018. Violence intervention, youth employment, resident empowerment, and connections between residents and resources. At the heart of violence intervention work are trusted outreach staff who build relationships with individuals involved in violence-promoting groups and their broader networks. These intervention specialists have a unique ability to counsel members of our community whom we all want to be able to choose a different path. Although connections with an intervention specialist are critical for changing the lives of some of our most at-risk young people, those young people have other needs too. Trauma, chief among them. That's why we're gathered here at Public Health today. In addition to being an access point for traditional health services, CPH is home to the Neighborhood Social Work Team and the CARE Coalition, which are connecting residents to resources every day. My colleagues and I, and especially Councilmember Priscilla Tyson, know how important this role of CPH is and know we must make it easier for at-risk youth and all residents to access the help they need. That help can change a life at a critical time, when one of our young people needs a meal or a place to stay for a night or two. But long-term success hinges on the ability to connect youth with great opportunities and economic self-sufficiency. The city already connects hundreds of kids to summer jobs each year, but as part of this initiative, Council wants to enlist employers in our community to create a pipeline to private and ongoing employment for the youth in our community, specifically for at-risk youth. To do all of this takes a village, of course. It requires that city leaders enlist themselves, human service organizations, business community, the faith community, and the people on the ground who are already doing the work. Just as critical is the role of our neighbors, whose voices must be at the center of the work, not on the periphery. So Council is seeking new ways to empower residents of violence-afflicted neighborhoods to reclaim their streets and break the cycle of violence. Out of our initiative's 4 focus areas, today we are announcing, and we're proud to announce, the launch of the first steps: expansion of violence intervention staff and community programming through the Applications for Purpose, Pride, and Success, or APPS program. We're devoting funds for 2 new intervention specialists to supplement the work already being done by the APPS team and its partners. These additions will allow us to cover new ground and expand the reach of positive intervention into the lives of our city's youth. Another critical part of the APPS program is the Cap City Night Festival series. These festivals bring needed resources to the community and open up key neighborhoods to intervention. Council is adding funds and other support to ensure that this summer's festivals are bigger and better than ever. And because of the acute need at in the Wedgwood community, we will be expanding Cap City Nights this year to Wedgwood. In total, Council will be investing $250,000 in this work over the next biennium. With us here to share more about our program on the ground is Eric Brandon, Assistant Director for Youth and Family Development in the Recreation and Parks Department. Welcome, Director Brandon.
Good morning, and thank you, Councilwoman Brown, our Recreation and Parks Chair. Happy to be here to share a little bit about our APPS program with you today. The mission of the program, called Applications for Purpose, Pride, and Success, or APPS, is to reduce crime and violence by increasing protective factors in the lives of Columbus teens and young adults ages 14 through 23 through proven prevention and intervention strategies. The APPS program provides a fun and safe place for teens and young adults to receive guidance and personal development. The APPS prevention strategies include offering constructive alternatives to violence, while family development specialists provide mentorship through enrichment activities at 4 community recreation centers. APPS links families to services that meet immediate needs, along with others that lay the foundation for long-term goal attainment, which ultimately produces productive, contributing members of our society. The Neighborhood Violence Intervention Program, or NVI, consists of street-level violence interruption and conflict mediation, teamed with case management and support services to address the risk factors that can lead young people into a life of crime and violence. This put into practice by intervention specialists who build relationships with young people that are partially responsible for driving the violence in our communities, directing them to healthy alternatives that have redeeming value. Our intervention specialists have unique and diverse backgrounds with education and experiences that assist them in connecting them with today's youth. You can see the impact this program is having on the boards provided before you. I think this board over here on the right, your right, has some stats. We also host events called Cap City Nights. These summer festivals are a prevention strategy that fosters safe and healthy community relationships by bringing together neighborhood residents, worshipers, service providers, and business owners. Festival activities encourage relationship building among families, neighbors, and strengthening community ties and empowering the community to work together to reduce violence. This also creates a platform of trust to produce positive change. Our free Cap City Nights festivals feature food, live entertainment, and a host of games and activities for the entire family. Our fourth component is a job readiness program which expanded this year, and we're currently serving over 100 youth, providing 128 hours of soft and life skills development, as well as a certification in CPR. I want to thank Council for their ongoing support and the additional funding which will help expand this program. And so now I bring to you someone who needs no introduction, Councilwoman Priscilla Tyson.
Thank you, Eric. Good morning, everyone. I am really encouraged by the work that we are collectively doing to benefit our residents. And I want to thank Dr. Mashika Roberts for hosting us and the whole Columbus Public Health family for hosting this press conference today. So we're all working together to help to make sure our community is a safe one for everyone. And so I want to thank Columbus Public Health, Recreation and Parks, of course, my colleagues on City Council, and then I see out at this press conference, I see individuals, community leaders who are certainly working on this initiative also. And I want to certainly thank them for the work that they do in order to help make this a healthy community. I am pleased that we're taking a comprehensive approach to safety, which will require each of us to address the intersections of mental health and trauma in public safety. For the last 4 years in Human Services, we have been funding the NetCare, which is the community response expansion program. This program comes out when there's trauma in the community, works with Columbus Police Department. We've been funding them at $138,000 each year to be there, to be a first responder to mental health, to trauma when it occurs in the community. In 2016, a team at Columbus Public Health had the insight to convene the Columbus CARE, Community Action, Resilience, and Empowerment Coalition. And this really stemmed from an issue of trauma in the Hilltop. And Columbus Public Health came together to work with the community to make sure that we're there to help work with individuals when there is trauma. The CARE Coalition's mission is to engage, support, and educate both Columbus residents who experience trauma, as well as community organizations who serve those residents, including mental health providers, community organizations, and city government. As we are addressing safety, it is vital that we do not neglect services and treatment to residents and neighborhoods who are experiencing trauma. Doing so puts our entire community at risk. As the chair of Health and Human Services Committee, I am absolutely committed to work with the CARE Coalition to identify opportunities to further support the residents and families that they serve. I am supporting the CARE Coalition and building upon the work they have already been doing and expanding their network of community partners and organizations, increasing their ability to offer wraparound services for families who are already coping with difficult situations. We understand that someone who's experiencing trauma may also have other needs that could be served by the social service agencies, the great social service agencies in this community. Those providers that will identify is a family in need of food, of housing, of employment, and any other services. In order to help families, we have to use a holistic approach. Council will be providing additional funding in order to support the enhancements for the CARE Coalition service delivery. We recognize the value of this program and it's important to our community. So I will be working with Columbus Public Health, the CARE Coalition, to identify those nonprofit organizations and services that we may need to support our families. And so as I conclude, I want to invite Felicia Saunders to the podium to share her story.
Good morning, everybody. I want to thank the mayor and the city council leaders, who are great leaders in our city, and also the CARE Coalition for inviting me out to talk about what I do in the community and the loss of my son, Anthony Ray Sowers, who was murdered in my community, the East Haven community. It'll be 9 years in August. Unfortunately, he got shot in the back by a young man who had beef with someone, and my son was trying to get him to squash their beef, and the young man came after my son. Through that whole process, there was not a lot of resources out there when I went through this. And you know, as a mother, you can be really broken by seeing your child laying there dying. But as years go on and going down to city council and talking to them about my concerns, going to my corner stores, talking to the youth, trying to get them to redirect their thinking on gun violence, going to the parks, you know, talking to the children about keeping their community clean, you know, there was not information for me to give them as far as resources that were available. So to have this come forth is a blessing for me, and it answers my prayers, because people always look to me for resources, because I'm a person that goes out and finds things for people, you know, and this right here can bring this closure to some of these mothers. Are so broken, they can't even function anymore, you know. They don't know that there's resources out here at the health department that I didn't even know that were out here at the health department to be able to help them. And to see our city leaders and our mayor take this initiative on, it just warms my heart, and it just makes me feel like Columbus is a great city to live in, and I understand why people want to come here and be a part of our community. Every August, I do a youth summit with Terry Nooney Green with Think, Make, Live, and we bring in youth to talk to them about community leadership. We talk to them about health and fitness. We talk to them about violence and what they can do in their community to keep the violence away. We know we can't eliminate all the crime in the world because there's good and evil, but we want to do our part. So I just thank everybody for taking the initiative to step up, do what they can do. And I always tell people, you know, they ask me, why do you go walk up to gang members or you walk up to pimps, and you know, and they're fearful of me? And I tell them I don't have any fear, because when I go, I'm walking in love. You know, by the time I end up talking to them and leaving them, I'm getting love and I'm getting hugs. So with this program, I think that's what we're going to get. We're going to give people the opportunity to have resources to come to the healing that we need in our city. And I predict that this year, our crime stats will be lower than last year. And that's why I asked everyone to pray that we continue to keep doing the work that we can for our people of the city of Columbus and our youth. And I thank you.
Thank you, Ms. Felicia. Your strength, your advocacy, your work in the community is going to keep Columbus safe. It's keeping Columbus safe as we speak. So this list of initiatives are additive to create a comprehensive strategy to keep Columbus safe. You know, there is a predictable series of events after a shooting. We come together, we hold vigils, we have a community conversation, which are all critically important to deal with the trauma that happens after one of these incidents. But we have to be proactive too. And so as part of this strategy, we're going to have community conversations. We're going to set them up now. We're going to work with community partners like People's Justice Project and with our churches and with our community to have proactive conversations about how we can keep Columbus safe, how we can work together to deal with these instances before they happen. And so that's what these conversations will be about. These forums I just mentioned are a part of our community's larger conversation about stopping violence. This conversation is about reducing violent crime, not just by a little bit, but reducing it altogether. And the work will not be done until we have no more murders in Columbus. With that as our North Star, we've got a long way to go. We have to stack hands and work with our community partners and community-based violence intervention efforts. We can empower our neighborhoods. We can connect our youth with employment. We can expand the capacity of violence prevention programs, because safety is a right. It's a right of every individual in every community, in every street, in every cul-de-sac, and that is what we will work together on, is creating that safe space, and that safe space being Columbus. Thank you so much, and we'll take questions individually, I think, with the council members and folks who are assembled here. Thank you for being here.
Thank you.